cancer is a huge problem in the United States, and it's really important to us that we have clinical research trials that are available to our patients with this disease. GI cancer is a catch-all phrase. It's cancers that start anywhere along the gastrointestinal tract.
The real neat thing about how we treat each individual GI cancer is that most of the time they share similar histologies. So the overlap now is really trying to understand both at a molecular level and at a histology level or organ type level, and combine that information to come up with the best strategy for a patient.
And it's really important that we have therapies targeting each of the different types of GI malignancies. As the GI clinical research team, our goal and our focus is to make sure that we have a clinical trial available to every single patient that walks into the University of Arizona Cancer Center. Our goal is to have clinical, translational, transdisciplinary trials that focus on novel treatments so that we can hopefully offer something different and cutting edge to every patient we see.
Colorectal cancer in particular has been a poster child for developing new novel treatment strategies for patients.
In the last 5 years, I think some of the biggest advances in colorectal cancer have been related to immunotherapy. We've recognized that we can train patients' immune cells to find and treat colorectal cancer, specific subtypes.
If you were born in 1990, you're 4 times as likely to get rectal cancer as opposed to if you were born in 1950. Twice as likely for colon cancer.
And so there have been important changes in screening guidelines related to earlier starting of colonoscopies in terms of screening for patients now 45 and over as opposed to 50 and over, which hopefully will help us find these cancers at earlier stages when they are still potentially curable.
We've really utilized our histology, meaning where does that cancer start from in which organ, to help treat people. We're using biomarkers more and more to identify the right treatment option. These biomarkers are really the foundation for a new era of treatment.
So our hope is that we have the ability to do not only clinical research, but translational research that allows us to take what we're learning in the clinic back to our scientists, to our cutting-edge, world-renowned researchers, and learn from every single trial that we open, and vice versa.
It's the best of both worlds in taking care of patients and being on the cutting edge of research. Combining those two, I don't see any other greater passion or fulfilling job.